Right now, a very real deadline is looming, one that could change the lives of millions of Americans in ways most people aren't even aware of. The future of health insurance for millions hangs in the balance, and the stakes couldn't be higher for families across the country who depend on affordable coverage. On December 31st, 2025, just 2 weeks from today, a critical part of the Affordable Care Act, the enhanced subsidies that have kept premiums low for so many, is set to expire unless Congress steps in. These subsidies have been a lifeline, making health insurance affordable for about 24 million people who buy coverage through the ACA marketplace, people who otherwise might not be able to afford it at all. If Congress fails to act, these subsidies will vanish overnight. That means millions could wake up to find their premiums have doubled or even tripled, putting basic health care out of reach for many working families. Lawmakers have known this moment was coming for years. But now, with the deadline just days away, Congress is mired in chaos and gridlock, unable to agree on a path forward. The real drama isn't just the usual partisan fight between Democrats and Republicans. This time, the deepest divisions are within the Republican Party itself, as members struggle to find common ground. Party leaders are pushing hard to end the subsidies, arguing that the government can't keep spending at this rate. But a handful of moderate Republicans are breaking ranks, worried about the real-world impact on their own constituents, people they see every day in their districts. The central question is simple, but the answer is anything but. Should the federal government continue to help millions of Americans pay for health insurance, or should that support end no matter the consequences? For Democrats, the answer is clear. They want to make these enhanced subsidies permanent, arguing that affordable healthcare is a basic right, not a privilege. Republican leaders, on the other hand, call the subsidies wasteful government spending. But moderates in swing districts are caught in the middle, facing pressure from both party leadership and worried voters back home. The result? A high-stakes political showdown, with the healthcare of millions of Americans hanging in the balance. The decisions made in the next few days will ripple through households, hospitals, and communities nationwide. This isn't just another policy debate. It's a political brawl that will determine whether Americans can afford to see a doctor, fill a prescription, or get the care they need next year. The clock is ticking, and the outcome is far from certain. Every hour that passes brings us closer to a potential crisis for millions of families. Under the Capitol dome, ideology, political survival, and the real-world needs of everyday Americans are colliding in a dramatic showdown. What happens next will shape the future of American healthcare for years to come. To really understand the heated debate happening in Washington right now, you first need to know what ACA subsidies are and why they matter so much to millions of Americans. Before the Affordable Care Act, buying your own health insurance was often extremely expensive. Many people were left out in the cold, especially if they had pre-existing conditions. Insurers could simply deny them coverage or charge sky-high rates. The ACA changed that by creating online marketplaces where people could shop for plans. But more importantly, it offered tax credits, known as subsidies, to help lower the cost of coverage for those who needed it most. Originally, these subsidies were only available to people earning up to 400% of the federal poverty level. That meant if you made just a bit more, you were on your own, facing full-price premiums. But during the pandemic, Congress stepped in. They made the subsidies much more generous, and crucially, they removed the income cap. Suddenly, even middle-class families, who previously got little or no help, could afford coverage. Now, that expansion is set to expire soon, unless lawmakers act. The clock is ticking, and families are anxiously waiting to see what happens next. These subsidies aren't just for one group. They help early retirees who aren't yet eligible for Medicare, gig workers and freelancers without employer coverage, small business owners, and families living in rural areas where options are limited. For 24 million people, these subsidies are the difference between having health insurance and facing medical emergencies completely uninsured. Without them, many would have to gamble with their health and finances. Without these subsidies, a typical family of 4 could see their monthly premiums skyrocket, from a few $100s to well over $1,000. That's a massive jump, and for many, simply unaffordable. That's not just a hit to the family budget. It's a full-blown crisis that could force people to drop coverage or go into debt. As politicians argue over the future of these subsidies, millions of Americans are left facing impossible choices, wondering if they'll be able to afford the care they need, or if they'll be left behind once again. The battle over subsidies exploded on the House floor just this morning, turning what was expected to be a routine session into a dramatic showdown. Tensions had been simmering for days, but today, they finally boiled over in front of the nation. Democrats, blocked from a vote on the crucial healthcare subsidies, tried a last-ditch procedural move to force a 3-year extension. Their efforts were met with fierce resistance from the Republican majority. The result? Absolute chaos. As voices were raised and order quickly broke down. The vote itself was razor-thin, with lawmakers scrambling to cast their ballots. In a stunning move, the presiding Republican abruptly closed the vote while members were still trying to participate, leaving many stunned and angry. Democrats erupted in protest, calling the move illegitimate and accusing Republicans of dodging responsibility for the outcome. Shouts echoed through the chamber as tempers flared. Republican leaders, however, dismissed the outrage, insisting the vote was proper and within the rules. They accused Democrats of grandstanding and trying to manipulate the process for political gain. But the incident exposed desperation on both sides. Democrats fighting to prevent what they see as a looming healthcare disaster, and Republicans scrambling to control their fractured majority and maintain order in the chamber. The chaotic vote was more than just a procedural fight. It was a vivid display of a Congress paralyzed by dysfunction, unable to find common ground even on issues that affect millions of Americans. Trust between parties has all but vanished, and compromise is now even harder to reach. The atmosphere is thick with suspicion, and every move is viewed through a partisan lens. Meanwhile, the healthcare of millions of Americans hangs in the balance, hostage to political gamesmanship. As lawmakers argue, the clock keeps ticking, and real people wait for answers. The real shock came from inside the Republican Party. 4 moderate Republicans, Fitzpatrick, McKenzie, Lawler, and Bresnahan, chose their constituents over party loyalty. Representing swing districts, they know premium hikes could cost them their seats. Lawler called his party's inaction idiotic and political malpractice. For these lawmakers, local realities outweigh party ideology. Fitzpatrick put it bluntly, letting subsidies expire would be a disaster. Their rebellion put Speaker Johnson in a bind, caught between hardliners and moderates. With a razor-thin majority, even a few defectors threaten his control. The GOP is now a party at war with itself over health care. Blocked by leadership, the 4 GOP rebels joined Democrats in a rare move, a discharge petition. This tool lets a House majority force a vote, bypassing the Speaker. It's almost never used, but this time, the rebels' signatures pushed it over the top. For Speaker Johnson, it was a stunning defeat. He lost control of the floor. Now, a vote on a 3-year subsidy extension is guaranteed. There's a mandatory waiting period, so the drama will spill into the new year. For 24 million Americans, uncertainty drags on. But a vote is finally coming. Power has shifted, at least for now, to a fragile bipartisan majority. Under pressure, Republican leaders offered their own bill, the Lower Healthcare Premiums for All Americans Act. Instead of extending subsidies, it pushes market-based changes, like expanding association health plans for small businesses and freelancers. The idea: more bargaining power, lower costs, less federal spending. The Congressional Budget Office says the bill would cut the deficit by $35.6 billion over a decade, but also leave 100,000 more people uninsured each year. Some would see lower premiums, but others, especially older or sicker Americans, could pay more. Democrats warn this could bring back skinny plans with poor coverage, hurting those who need care most. The GOP bill isn't a simple fix, it's a different vision for healthcare. The debate is now between 2 starkly different approaches. The stakes are real and immediate. If subsidies expire, premiums for 24 million people will soar. Some families could pay thousands more per year. The Urban Institute projects over 3 million more Americans would become uninsured. The Republican alternative would save money but leave more people without coverage, especially the vulnerable. Experts warn of a 2-tiered system: cheap, bare-bones plans for the healthy, expensive comprehensive plans for the sick. The Democratic plan costs more but keeps coverage stable. The worst outcome? Doing nothing. Chaos for families, hospitals, and insurers. The clock is running out, and the consequences are huge. This fight is about more than subsidies. It's about 2 visions for American healthcare. Democrats want universal coverage, seeing healthcare as a right and government as the solution. The ACA, with its subsidies and regulations, is their main tool. Republicans believe in free markets and limited government, seeing the ACA as overreach. Their goal: less regulation, more competition, and lower federal spending. The GOP's bill reflects this, focusing on deregulation over subsidies. This isn't just a policy disagreement, it's a clash of worldviews. That's why compromise is so hard. Meanwhile, 24 million Americans are caught in the crossfire. So, what happens next? Thanks to the discharge petition, a House vote on extending subsidies is coming soon. It will likely pass, but the Senate is another story. Recently, it rejected a similar extension. Some senators are working on a compromise, a shorter extension paired with ACA reforms. Speaker Johnson faces pressure from both hardliners and moderates, his leadership on the line. For millions, financial planning is on hold, waiting for Congress to act. The most likely outcome? A short-term deal that delays the fight, not resolves it. The fundamental conflict over healthcare's future remains. The clock is almost out, and the stakes couldn't be higher. The fight isn't over, it's just paused. For now, millions wait and hope for relief.